Good afternoon. I'd like to call to order Cuyahoga County Health and Human Services and Aging Committee, Wednesday, March 22nd. Can we have a roll call, please, Madam Clerk?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll for Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Stevens. Present. Ms. Turner.
Present.
Mr. Miller.
Here.
You have a quorum.
All right, thank you. Anyone signed in for public comment, Madam
No,
Clerk?
Madam Chair, no one has
All
signed in.
right, none today. Ms. Lou, we miss you. All right. We have approval of the minutes from the March 8th meeting. Could I have a motion and a second?
So moved. Second.
Okay, moved by Turner, seconded by Sweeney. All in favor, please say aye.
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 Right. We have several, maybe one. Is that one agenda item? No. We have several agenda items today before us, so we will get right to it. Just a little side note, I apologize. There were things at City Club today, so I allowed my colleagues to get back, so that's why we're starting a little bit late.
Thank you.
You're welcome. Madam Clerk, if you could read the first item into the record, please.
Resolution 2023-0062, authorizing an amendment to a contract with Kaiser Group LLC, doing business as Dynamic Workforce Solutions for Title I Business Services in connection with the Federal Workforce Innovation and Opportunity Act for the period January 1st, 2023 through June 30th, 2024, to expand the scope of services to provide program support and financial services for the Cuyahoga County Skillet Program, and for additional funds in the total amount not to exceed $1,250,000, effective April 1st, 2023.
All right. Oh,
Good
Welcome.
afternoon, council members. Paul Herdig, Director of Development, and with me is Vaughn Johnson, Deputy Director of Development for Economic Development. I'm just going to give a few framing remarks, then Vaughn's going to give a little bit of information about our Skill Up program. This item before you is not a new expenditure of money. It's a contract amendment that directs some of the Skill Up money that's already been authorized in the budget into a contract with Dynamic Workforce Solutions. Dynamic Workforce Solutions is the entity that our Workforce Development Board has hired to do employer services. So they were selected through a competitive process to serve employers in a variety of ways with workforce needs. We're bringing this amendment before you in order to streamline the way reimbursements are made to businesses for the training they do under our Skill Up program. So with that framing, and I will be available for questions, I do want to, at this point, have Vaughn come, and let's start the PowerPoint, please, Sharon. He's just got a couple slides for some general Skill Up information, and then we'll dive into the amendment real quick.
Thank you. Vaughn Johnson, Department of Development. You know, one of the questions that I get asked often is what is Skill Up? What does Skill Up actually do? And the way that my team and I describe this and the department describe it is we have a tagline that says, we train, people get paid, and then you grow. And so what does that mean? The training part is by developing training plans for employers, we create pathways and on-ramps for residents to get trained and upskilled and offer incentives to the company and the resident to do so. Getting paid. Employers increase wages after training that benefits the resident, Cuyahoga County, and the business, and then, of course, grow. Residents grow with new skills, income, businesses receive financial incentives, and the county can receive additional tax revenues. And something you may not be aware of is every resident that earns a credential also is eligible for a $250 bonus for the credential attainment. So it creates a win-win-win for all parties involved. This next slide illustrates some performance measures from HHS year-end 2021 to illustrate some of the demographics of the participants in the Skill Up program. And as you can see, over 63% of participants in the Skill Up program were receiving county assistance, and over 76% of the participants receive benefits in general. And then, of course, Skill Up continues to grow. You've probably seen a number of new companies coming before, other boards and other things like that. Skill Up is really, really growing. We've established a great referral relationship with our ecosystem partners. And over the last 9 months, we have almost 300 new participants or residents ready to be trained in Skill Up. So this case study I wanted to share with you is just an example of some of the regular types of titles and classifications that we get coming through Skill Up. The first one is STNAs, and you can see their starting wage is typically around $11 an hour, and then after training and their certification, it's over $14 an hour. And then the other one is home health aides. A little over $10 an hour it starts, and then it ends when they finish training at over $14 an hour. And then just in general, overall Skill Up, I believe the starting wage is around $15 an hour for just general titles, and then it ends around $18 an hour. So the average Skill Up participant gets about $3 an hour increase. So this is the part about, you know, Dynamic Workforce Solutions, and I want to make sure that I cover this, what Paul kind of alluded to earlier. By engaging Dynamic Workforce Solutions, This will allow SkillUp 2.0 to serve more businesses by streamlining the reimbursement process and taking away the barriers so we can serve more residents. This new reimbursement process will match best practices with our workforce development on-the-job training. And of course, Dynamic Workforce Solutions, as Paul alluded to, was selected through a competitive process. And with that, I will open up to questions.
All right, any questions for Mr. Johnson?
Yes, please.
Councilwoman?
It's a laudable concept. I'm quite proud to be affiliated with it. But you're talking about the most significant change is that the reimbursement project will be a way to expedite getting cash to the folks who participate in the program or to the folks who are vendors in the program.
To the vendor companies.
Okay. What has been our problem to date?
It's cumbersome. It typically is cumbersome.
And so how will we?
And also brings it into a best practice with the other organizations that we work with.
So what is the best practice? Because you tell me about the program, you tell me this change will make it faster, and the change, it's just language. I don't understand what the change is.
Thanks, Councilwoman. And I'm stepping in because I've been associated with SkillUp actually longer than Vaughn. Vaughn came on about a year and a half ago, has done great work. But the situation we're talking about actually goes back to the start of the program. When the SkillUp program was set up, it was set up in such a way that the businesses, in order to get their reimbursements, had to do all the paperwork that someone would have to do if they were actually a county vendor. So even though, for example, Vaughn gave the example of a nursing home where the nursing home is training their home health aides, even though the nursing home is not providing services to the county, it's just getting reimbursed, the nursing home had to go through all the paperwork a vendor would have to go through if it was actually a county service provider. And so what we're doing now is we're changing this so that that nursing home only has to deal with the nonprofit Dynamic Workforce Solutions. They can be reimbursed much more quickly. Everything is still checked to make sure their paperwork's right, but they don't have to go through the process of registering as a county vendor because they're not providing any service to the county.
So we hope we'll do better with having just one vendor instead of a series of them.
That's correct, Councilwoman. And the reference to what's done in on-the-job training, our Workforce Development Board made this change several years ago. So in the distant past, every time a company was going to have an on-the-job training arrangement, they had to come before our Board of Control with a separate contract. People may remember seeing Frank Breckner coming to Board of Control for this. And our Workforce Development Board several years ago realized this was also slowing them down and actually driving business away. So they made the change to having a nonprofit third party actually do the reimbursement to the businesses. So we're very simply adopting the same practice that our Workforce Development Board has been using for a number of years now.
And how are we going to make sure we don't drag out payments to this agency? Because the same thing can still happen if we haven't made internal changes. And you know, I've been one of the council members who's not real thrilled about our disbursement process.
Thank you, Councilwoman. First of all, Dynamic Workforce Solutions is up and running now as a vendor. They are a county vendor, and Laura Chalker from the Workforce Development Board is the deputy director over there who's got them up and running. So they're fully set up in the system. They're actually drawing monthly reimbursements now for the work they're doing now. So this will simply be added on to their monthly reimbursements. There won't be a long startup period that's needed.
So are we agreeing to do some disbursements in advance?
Thanks, Councilwoman. No, there will be no advanced reimbursements. They're a large enough organization, their cash flow is okay, but we will be turning around on a monthly basis the reimbursement of what they do that month.
It's just that we've had glitches before. We have one we're solving right now. And a piece of legislation that I don't clearly see actually finds a way to expedite things it's just a piece of legislation to me. I'm concerned that we have a growing problem where we're not dispersing on a timely basis to the folks who help us deliver a safety net to people who really need these benefits. And so we almost break the people financially who really just want to help more people in Cuyahoga County.
Councilwoman, thank you. I am aware, Director Merriman has mentioned to me these concerns and also corrective actions that Director Merriman is taking. And I would simply say, in this particular situation, we're talking about one contract with one vendor, Dynamic Workforce Solutions, and the other element is that we do have the staff of the Workforce Development Board involved in this to make sure, additionally, that things are moved along for Dynamic Workforce Solutions.
Do we have somebody from HHS who can tell us what changes they're making to? I thought I saw you back there. Did you think you could just stay above the fray?
Good afternoon, David Merriman, Department of Health and Human Services. I think the question that I'm responding to is what changes we're making in our system to improve payment. I think that's half of the issue. I think there are two parts to the issue, which is improving timeliness for getting contracts through the entire procurement contract and the procurement process and the legislative process. And then the second part is once the contracts are executed, ensuring that we're making timely payment to our vendors. I think we have to focus on both ends of that issue. I think the first thing that I would acknowledge, we're very grateful to have the inclusion of Chris Murray joining our staff last week. Chris, the former director of the Office of Budget and Management and the treasurer, brings a strong background in business operations. And Chris and I are talking about how we add additional support to the existing staff. The staff that we have in DHHS is outstanding. I don't want this to be in any way an undercutting of their work. I think they do a higher volume of work than anyone else that I'm aware of. We process over 5,000 payments a month, vouchers a month. We operate at a level and a scale that I think is unparalleled in the county. And so there are errors and there are problems, and we're addressing them. Some of the examples that I'll kind of share. In the past, what we've done is we've had, in essence, a document, a system where we track every one of our contracts. That's managed by our contract department, our Division of Contract Administration Performance. I think it's comprehensive. It hasn't been posted and shared across the departments so that everybody understands where exactly their contract is in the queue, and if it's delayed, why, so that they can offer support and we can find resolution. So we'll actually increase internal transparency on that. I think along the same lines, we're talking about standardizing a lot of the expectations for invoices. There are times that invoices come into us, they're right on time, and we don't respond quickly because there are other invoices that have been delayed, and we're trying to, just respond to all of the invoices. I think we need standards in terms of when invoices will be submitted to us, what expectations providers should have from us, and then what internal expectations we have amongst ourselves.
So that is a wonderful perspective. Having been on your side of the table, when my vendors, as a former director, there were some vendors who always, the end of the month, within 5 business days, would turn in their request for a reimbursement or payment. And I tried to get them paid on the same kind of schedule, that it would take 5 to 6 business days to review their documents so that then I could submit them for payment. But the folks who came in at a different time every month, they typically created problems for us. And so if you have an internal schedule, is that now what your team is going to do? So that when people come to us as elected officials and say, I haven't been paid in 4 months, we can say, well, did you turn all your paperwork in? Yes, ma'am. Okay, were there any glitches? Well, there was a problem in the second month. Well, that may have triggered a delay for all of them. So are you going to be sharing with our team so that we understand, or at least the persons we can call and harass the most, being Jonani and his team, so that we understand this process and how our vendors will get paid as closely as possible to a standardized time?
Yeah, so please know there is a system in place. I'll acknowledge it's more along the lines of spreadsheets that we keep on documenting the date every invoice comes in and the date that it's then processed from the program side to our fiscal side. So we track that. What we're going to do is we're going to provide it to more people so that there's more awareness of where in the stage we are in making payments. And I'm confident. I'm confident that staff will pick up the pace for everyone. Vendors that get their invoices on time, unless there's a delay in the contract, to get paid on time. I can tell you we have vendors that were complaining about being paid slowly that submitted their December invoices in the beginning of March. In that situation, if you submit your payments, your invoices 2 months after the close of the contract, your expectations are not going to be the same as someone who submits it, 30 days after the close of the
And
contract.
I agree with you on that. But we have some where we have cases where there's been a long delay and we've had millions of dollars outstanding to parties.
Yeah, those delays are generally associated with the close of a contract year where the contract is closed in December and the last payment you can make on a contract from a calendar year is generally the first couple weeks of December. And so we end up needing to reopen the contract in January and then make payment on the prior calendar year's contracts. What we're looking at is either starting those contracts moving forward, having all of our contracts start in January, or having them end in November, so you don't have contracts ending in the month where you can't make payments. I think that's a flaw that we have to take a look at.
I'd be supportive of that because since you and I have spent years in this system, we know that if people don't get told up front, we're closing because we've got to do reconciliation for year end in order to do the audits. This is state law. This is not just us being pejorative. Then those folks, my council colleagues and I, will have some sympathy for them, but that's about all we have for them. When they've been turning their documents in on time regularly and there's still another glitch, to be polite about it, and they have to go into their lines of credit when they doing business with Cuyahoga County should be something you can take to the bank.
I absolutely agree. I think it puts you in a tough position. I recognize that. I can guarantee you won't have another close of the year the way we had last year. In the past, we've said that as it relates to board and care providers. We've addressed those issues. What we had this year, I think, is definitely regrettable. A lot of it is tied to the increase in work that we did in 2022 to move a lot of ARPA dollars that we did. But I think we ended up pushing our deadlines, and we have to recover for those. The other thing I just have to say, it's regrettable, and I know I'm working on it with my staff. We're gonna correct it. This is really though about clients. Our providers have served our clients. And our providers they're more than providers, they're our partners. And if we don't address their needs, we put them in jeopardy, and they are unable to meet our clients' needs, which is the point. This is why we're here. So we take this very seriously. We are going to address it. You will not have another year the way you had last year close out.
Thank you, Mr. Merriman. That was exactly what I needed to hear.
And thank you for your patience on it. I do also want to acknowledge Councilwoman Conwell and staff Levine Ross have been very engaged on this. I think they've got a lot of tough questions. Some of them we still have to answer. We are working on it. It's not set, but I can commit to you, we'll not have another closeout of last year the way you had this year.
Unfortunately, I was unable to participate in the conversations that my colleague and Levin had with you. But I was staying up to date on them, and some of those folks sent letters directly to us and made calls to other members of this committee. And I, like you, believe the county is a good safety net. And a lot of us work incredibly hard to make sure that seniors and children and people who need to transition in their careers or their lives don't fall through the net and end up in the worst place that we have to take care of them at a homeless facility or shelter. And so what you do is incredibly important to us. Sometimes we're not as respectful as we'd like to be of you, but we don't discount you or the work that you and your team do. They're important to us, but we need you to tell us how to help you do it better if that's possible.
Point well taken. Thank you.
Thank you.
All right. Did you have a question? Councilman Miller.
So, Madam Chair, to the director, of the $1,250,000 that's in this contract amendment, how much of that money is for actual reimbursements to the vendors, and how much of that is for the fees that Dynamic Workforce Solutions will be provided to run the program?
Thank you, Councilman, for that question. Approximately $1,104,875 is for skill-up invoicing, and $145,124.85 is for staff costs and other direct overhead towards Dynamic Workforce Solutions.
Okay, so that's over 10% to,
It's actually 11%, exactly.
do we think we gain 11% in efficiencies by doing it this way?
Thank you for the question. I believe so. The fact that we'll be able to leverage this new relationship, recycle those dollars, and be able to bring more residents through training, I think that's worth the 11%.
And what is the total amount that's budgeted for Skill Up in 2023? And does all that money come from the HHS levy, or are there multiple funding sources? And if so, what are they?
I think Vaughn knows this, but I'll step in to make sure. Councilman, it's $3 million per year in the biennial budget, and it's all from the HHS levy. And the only note I would add is because Dynamic Workforce Solutions will be doing some of the processing of the reimbursements, there will be a freeing up of county staff time so that county staff will be able to do other important work, as some of their time will be freed up not having to process the reimbursements.
Okay, that's good to know. And I have heard questions raised as to, since not all of the participants are on low income, as to whether all of this is an allowable expense from the HHS levy. Has your office considered that issue, and do you have a response?
Thank you again for that question. And yes, we have explored that, and we actually submitted most recently that information over to the legal department to see if we get a legal opinion on that. But as far as we know, the research and the legacy people that, staff members that were with Skill Up from its inception, there's no evidence that supports that. Even the documents are personally reviewed.
You're saying there's no evidence that supports that some of it's not eligible?
Correct.
Is that what you're saying?
Yes, sir.
Okay. The other question I have is that the Skill Up program was started prior to this, when this whole new round of workforce development was done, using the sector partnerships. And my question is how this work relates to that work, and whether there's any overlap between what's being done under Skill Up and what's being done under the sector partnerships, and whether there's any opportunities to obtain any economies of scale by having this done all under one umbrella instead of having these separate programs.
Thank you, Councilman. And without going too deep into history, I would note that at the time the Skill Up program was developed, it was developed in parallel with the sector partnership approach to reorganizing the workforce development system. So it was always planned that the two would go hand in hand. that Skill Up is part of the county's own approach to providing training, especially to those who are receiving our public assistance, so they could earn higher wages, be less dependent on public assistance. This goes hand in hand with the support we give to the sector partnerships, the manufacturing, the healthcare, the IT, and we're now starting to support hospitality as well, so that the employers in those sectors can themselves formulate new practices in hiring, new practices in training, which will also increase employment opportunities. I will tell you that we actually, Vaughn works closely with the folks at Magnet, for example, so that the Skill Up training is in fact provided to many of the firms that are involved in doing the sector partnership work in manufacturing. But there's not a duplication of effort. The work the sector partnerships do is more focused towards convening the employers themselves, supporting the employers as they develop new approaches to hiring and training. And so we don't see that there's a duplication of effort or paying twice for the same services.
So under Skill Up, who actually does the training?
So in the Skill Up program, the company, the employer, whether it be a nursing home manufacturer, will select who's going to do the training. Our staff, under Vaughn's direction, may help them if they need help figuring out what the right training is. In some cases, it's pretty clear what the training is that's available. Other cases, our staff do some research to help them find it. But it remains the choice of the business, of the employer, who they want to use for the training. We review that. We sign off on that in advance. They don't, there are no surprises to us at the end, but it continues to be the employer's choice of how exactly to train their staff.
And are you saying that there's no comparable program under the sector partnership program to assist employers with the cost of providing training?
That's correct, Councilman. That is not one of the things sector partnerships do.
Okay, thank you.
Wanted to move on. Just thinking in regards to this, because there's been a lot of discussion, Director Hurdig, in regards to the use of the HHS dollars, and specifically for the organizations that are for profit. So I'm at I see that we're behind. This actually, it's from a period of 1/1/2023, but this is actually effective April 1st.
That's correct,
Yeah,
Councilwoman.
so I have the mindset of holding this up until we get the legal opinion from the law department. Is that going to present you any problems?
Councilwoman, there has been planning for implementation to start the transfer of the processing of the payments effective April 1st. They've scaled back the work within HHS fiscal anticipating this, and we've had we've had several planning meetings with Dynamic Workforce Solutions. So there could be a disruption in the reimbursements to the employers if we don't proceed as planned. I would advocate that because we, Cuyahoga County, have budgeted HHS levy funds for this purpose for 6 years now, that we would not, I would advocate that would be sort of the opposite, that unless we're advised to stop, we would continue doing business.
Well, I get it, but I think that's just, we were sharing upstairs how different understandings of the Skill Up program and how it was funded. I know I spoke with Ted Carter and yourself, when I learned about it. And so there was just a difference of opinion between staff and what they clearly understand and what I understand. So we just want to be clear. I'm going to ask Mark, if we let this move forward, is there a good possibility that you can get us an answer, a definitive answer before the next council meeting?
Mark Hydorf, Assistant Law Director. I can see who's been assigned to this and try to get back to you by the end of the day of where we're at and what the expected time frame on completion.
Okay, so our staff will make sure that the law department is fully aware of the opinion that we're looking from them and seeking. So I don't have a problem moving it out of committee, but if it's not ready for Tuesday night, if we don't have an opinion, we'll have to stop it at that point.
Thank you. And Councilwoman, I would further request, again, subject to possibly being pulled, that it be recommended for passage on second reading so that the implementation can start April 1st as had been planned.
Second reading suspension.
Yes, yes, Councilwoman.
Any other question?
I do.
Madam Chair.
Councilwoman Turner, then Miller.
I'll be quick. Thank you. Director or Deputy Director, was wondering that since this is funded 100% through the HHS levy, what is the intersection of this contract with the Federal Workforce Innovation and Opportunity Act? And are any portion of those dollars reimbursed by the federal government at this point?
Thank you, Councilwoman. We do coordinate, and that's why we're so glad that Deputy Director Laura Chalker is participating. We do coordinate this work with the work that the Workforce Development Board, our Workforce Development Department does using the federal funds. There's, again, no duplication. One of the distinguishing points of the Skill Up program, and one reason we've been able to get employers to use it, is there's much less paperwork burden because it's not federally funded. So whereas when using federal funds, every single person participating has to go through a lengthy eligibility process, the point of the Skill Up program is that it's local funding, and that level of eligibility verification is not required. So for that reason, we do not seek the federal reimbursement for this work.
Thank you, Madam Chair.
Yes. To the directors, of the $3 million that was allocated in the budget, how much of it was actually spent in 2021 and how much was actually spent in 2022?
Vaughn, you want to give your best?
Thank you, Councilman. I'm going to ask my Business Services Manager, Laura, do you have that off the top of your head? I don't want to misspeak.
And as we bring Laura Simmons forward, I will note there has been a considerable pickup in business from 21 till 22, and there still is a little bit of a lag because the program model currently is that the staff has to get out and engage the employers, get the training plans developed, training plans approved, and only after the training is done, then does each individual payment come to the Board of Control for approval. So there is a bit of a lag. But understanding that, Laura, do we have the
Sure.
YOY?
So what you're looking.
Introduce yourself, please.
Laura Sims, Business Manager, Department of Development. So for what you're asking is how much we spent 2021 and in 2022? Okay.
Yes, please.
So about 200,000 in 2021, and then last year we encumbered almost 900,000 for payments. Now, of that, we only actually paid out about 250,000. So, but because some of those purchase orders hit towards the third quarter, the fourth quarter, those payments will be coming around in 2023. So we are anticipating close to 900,000 to $1 million in payments this year from last year and for business that we will get this year.
And so, was the money from 2022 decertified at the end of the year so that this money would be paid out of the $3 million from 2023, or was it able to be carried over, and for 2023 we have the carryover money plus the $3 million?
So there is no carryover on this program. With the HHS levy dollars, you get the $3 million each year, and that's what you get. We don't carry the money over from the previous year.
So that means that you said that it could be a total of $1 million, but that you spent 250,000. So perhaps 750,000 of 2022 expenses would be paid for in 2023, leaving you 2,250,000 for new expenses incurred in 2023. Is that correct?
Not exactly, because what will happen is it carries over. So the things that we would encumber in '23 may not get paid until '24. So while we're anticipating approximately 750 of invoices carried over from 2022, we would also anticipate that probably 500,000 would be moved over to that. So we're looking at more like $1 million to or what we have budgeted this year. Now, we do have a buffer of about 400,000 in that levy fund that we did not put into this contract in case we need to add more. But I don't anticipate that would be.
So, so you have 3 million in 2023, and 750,000 is going to be needed for you to pay for things that were encumbered in 2022, leaving 2,250,000. And so, and also 500,000 or so could be carried over into 2024. So actually, you could encumber 2,750,000 in expenses in 2023 within your budget, and then carry over 500,000 of it into 2024. Is that correct?
No. And the reason is that 1 million is set aside for staffing costs. So right now, we only have 2 million for contracts and for the Skill Up program itself to pay. So right now, we're looking at, of the 2 million, we've got 750,000 from the last 2023, and then that would be 1,250,000, which is what the contract is for this year, for the rest of the things. So that 1 million is set aside for staffing costs. Now, we will not expend all of that because we only have 2 staff people, and we've got one that's a vacancy that we're looking to fill. HHS has some of their staff that helps out with the procurement on that as well. I'm not aware of how that happens, but I think it's pretty much our staff that hits that. So there is quite a large amount of that 1 million that's not being expended for the program. And we've saved money on that with these contracts because we don't have to hire additional people with salary and benefits because the contract will be handling some stuff for us.
Okay, well, it's a complicated picture, but I get the general idea. So I will close with that. Thank you.
Okay.
Well, if there's no further discussion, I'm willing to move this forward.
All right, yes.
So I make a motion that we move this expeditiously to
Madam
council.
Chair.
My colleague has a question.
Yes, Councilman Miller.
I'm sorry, but I thought of one more question that
Right.
I knew I had one more question that I was going to ask, and I want to ask it. And the question is you said that that you're not applying for federal reimbursement because of how much it would delay and add complexity to the process. But my question is if you were to apply for federal reimbursement, potentially what percentage of the cost could be federally reimbursed? Is it 10%? Is it 50%? Is it 90%? Can you give me some idea on that?
Thank you, Councilman. First, let me say, we don't have the data to be sure for the very reason that we don't require eligibility documentation. We can make some assumptions based on the fact that, as Vaughn testified earlier, well over half of the people trained turn out to be county assistance recipients, which means they did pass eligibility. So that would indicate that potentially half or more of those trained are in fact eligible for federal assistance because they are receiving assistance in other programs. I do want to caution, though, our experience is that employers are reluctant to get involved in any sort of program that requires very intrusive eligibility checks on every single employee. And I believe it would be very harmful to the program if we had to start requiring those kind of eligibility checks. I believe that that would be hurtful to the impact we're trying to achieve, which is helping low-income workers advance their skills.
Okay, well, I appreciate that information, and I'm not making any judgments at this time. I'm only trying to gather information. Thank you.
So what I have to say on that is I think we're also helping employers. So whichever way that we determine as a county to do and get reimbursed, that should not hold them up. But I'm going to turn it over to Councilwoman Stevens to move this forward. I'm not going to belabor it. We can talk offline.
We probably should talk offline collectively. I'd like to move that this committee move this to the full body of council under second reading suspension.
Yes, based on if they have the information.
Yes, with the caveat that the
There
law
you go.
department get us information as requested by the chair.
Second.
It's been moved and seconded. All in favor, please say aye.
Aye.
All right, thank you. Madam Clerk, if you can read the next item into the record, please.
Resolution 2023-0063, authorizing amendment to a grant agreement with Hitchcock Center for Women to support construction of a residential treatment and recovery center to support women experiencing substance abuse issues for the period September 13th, 2022 through April 30th, 2025, for additional funds in the amount not to exceed $967,800.
Good afternoon, Catherine Tkachuk, Office of Innovation. And this is an amendment to an existing grant agreement with the Hitchcock Center for Women to provide an additional $967,800 for support of their new residential treatment and recovery center that they're looking to build. This will bring the total of the support to the county, from the county, of $3,792,500. These funds are specifically out of the opioid mitigation fund and were appropriated for that on the February 28th fiscal agenda. And we do have members from the Hitchcock Center as well as the Finch Group, who is a developer on this project, here to talk a little bit about the project and, if wanted, and answer any questions.
I'd like to invite whoever would like to speak up in terms of, just to give us a highlight of, this is a very important project. It ties into so many things HHS does. It helps our mothers and our daughter and their children heal based on the treatment facilities that they attend. And it's a unique in that it does help keep families together and allow the children to participate when their moms need treatment for various issues. So I'm a sole supporter of this. I think it's very unique. And going down this journey, I also learned that our diversion center, I asked, as we had planned the diversion center, if females are picked up with mental health or drug addiction, and they're given the option to choose the diversion center. That's only a short period of stay. Where do they go from there? And it was the Hitchcock Center. So it all ties in to what I believe is the county continuum. So welcome. Introduce yourselves. Please state your name for the record. Make sure the green light is on.
Thank you, Madam Chairman. My name is Wesley Finch. I am the chairperson of the Finch Group, who is the development entity that has been working through this development of the new Hitchcock Center for the last 5 years. With me, and so we're in two components. One's the development side, and one is the operational side of what Hitchcock has been doing since the late 1970s. So with me up here today are Greg Keston, lay leader board president of Hitchcock Center, and Jason Joyce, who is the president and CEO of the Hitchcock Center for Women. So if your questions are on development, I would love to take them. I think it's important to get background on Hitchcock Center since it plays such an important role in the lives of so many people. So Jason.
Thank you, Wes. Thank you so much for having us. Jason Joyce, as Wes said, President and CEO of Hitchcock Center for Women. I'd like to take the opportunity just to briefly go over the handout that I gave to each of you. I know that we've spoken before about Hitchcock, so I won't belabor all the points. But I did want to highlight what I think makes Hitchcock different. And certainly our female-focused care with that intensive residential treatment. We served over 300 women last year in that very intensive service. Secondly, what we do that is highly unique is that we keep children together with their mothers. Children are allowed to stay with their mothers up until the age of 12. That is very unique within the state and even nationally, for at least from what I've been told. As we've had auditors come in throughout the state, we are the only ones that do up to that age level, of age level 12. One of the nice things about the location of our agency and the continued location of our agency is that it's close to Wilson Elementary School. And the children are able to go there. It's literally catty corner from where we're at. They were helpful through the pandemic and obviously now in getting enrolled in school. Thirdly, our medication-assisted treatment program, we do not restrict any medications. That is different compared to the majority of providers in Northeast Ohio. So we allow all medications on our campus, and we don't make any judgments about that. We really view it as reducing the barriers to entering treatment with things that the ladies that come to our facility have to go through. The last thing we'd want to put up is another barrier that if they're on a certain medication that they wouldn't be able to attend our services. And then lastly, and I think what is most unique to the new project that we're working on is linking treatment with housing. So we know that when you link someone to housing after treatment, they're 15.4 times more likely to remain abstinent after 12 months. That's an Ohio Recovery Housing statistic, so it holds true with a lot of research there. But with that, in this project, we're looking to add the permanent supportive housing, certainly continuing our recovery housing, and then growing our treatment services. So currently we have 24 residential beds available for treatment services. We'll have 42 moving into the future. We plan to continue at least our 45 recovery housing units, and then in addition to that, as Wes will go more through, 53 permanent supportive housing units added to the area. We also view this, and Greg might be able to speak to this a little bit, but the board and our initiative within the area believe that this is just the start, that our goal is to really promote and provide more recovery services within the community. Thank you.
Yes, Madam Chairman. Today, you come before us to ask for an additional 900 and change, in addition to the capital stack that already exists. This adds to that capital stack to help you produce a final development. Did you have a change in the total cost? Is that why we're seeing this request, and this is a source of funds that may have been available before? So the second question is, why didn't you ask for some of this before?
To the councilwoman through the chair, in doing additional due diligence and realizing the demands on Hitchcock Center for the number of folks who need help, we've increased the number of treatment rooms from 24?
30. It's 12 more.
12 more treatment, and we're also maintaining, Hitchcock Center is maintaining the recovery housing. That adds cost as opposed to, you have bathrooms, kitchenettes, if you will, rooms, that added a significant amount of cost. We felt that with the demands on Hitchcock right now to treat these women, that part is important. The housing side, and that costs more money. The housing side, really the plan has not changed in the last, I'll say, 6 months.
So the increase in size has triggered a need for an increase in supportive services?
Yes, that, and also the square footage has gone up, not significantly. We're also facing some financing questions about bankruptcy remote entities that we need for the housing, not for the treatment side. We have now redesigned the building so you'll have 2 new tax parcels, permanent parcels on the site. So Hitchcock Center for Women, the treatment facility, will be on its own permanent parcel number, its own tax lot number. The housing will also be on its own, so there'll be separate ownerships. There'll be a third parcel out there, which is the existing building and some area around the existing building that's required. So those are the changes that have been made that we feel provide a much better solution and allow for financing of this property. I will tell you that this morning we met with National Equity Fund, who's represented here today by Stacy Woodford, and Fifth Third Bank, who is providing both the debt and the equity on this.
And they're the buyers of the debt from the syndication?
They will provide.
Credits.
They're the tax credit equity provider, yes. NEF, National Equity Fund, with Fifth Third Bank, basically representing Fifth Third Bank. And then Fifth Third Bank will be issuing a tax-exempt $9.2 million bond, underwriting, a $9.2 million tax-exempt bond, since along with the $5.5 million that has been allocated to this property by Ohio Housing, we need what is called 4% tax credits.
That was
Therefore, you
my
need
next
tax
question.
exempt.
Is
You
this
know
9 or
all
4?
this stuff. I apologize, Madam Councilwoman. I understand you're very familiar with all this. Ask any questions you want, but
I just wanted to know why you didn't ask for the 9 before, because as you know, my colleague is very supportive of this project, to put it politely. So she, since she typically holds my hand on a lot of other things, when she was holding my hand, a little money slid out of my hand the last time she held it for your project. So
aware
that
of
makes me ask a lot of questions, because her hand holding has helped me become an ally as well. And I want to make sure that we can clearly defend use of a pot of money that's not being used traditionally toward a project that has a lot of housing implications for it. And so we're happy to support it. I just want to be on the record with why this one is different, and that we can't justify it for any other program that we're doing housing for.
And thank you. And as I know you're aware, the housing, the treatment housing, is of crucial importance to get the women started. Then you have recovery housing. Treatment housing is for 45 days?
Up to 45.
Up to 45 days.
And so this 900 is instrumental
To
in that.
get more. At this moment, they have 24 active treatment. Oh, they're full. They cannot take any more. So we believe the demand. I'm not the treatment expert, far from it, by the way. But in talking a lot with Jason and with Greg Keston, unfortunately, we see the demand going up.
Good. Thank you, Madam Chair.
All right, Councilman Miller.
So first, I'd like to say that I strongly support this legislation. I consider it an appropriate use of opiate funding, as it will provide a long-term expansion of our capability to help people who are dealing with opiate addiction. My question is whether this additional funding brings you to the total level of funding needed for the project, and if not, how much of a gap remains?
Let me respond 2 ways. First, we submitted to Ohio Housing the final package, so we believe we can be in the ground in July of this year. It has to go through the processing, but Ohio Housing has already allocated $5.5 million of ARPA funds to the housing portion of this property, and NEF and Fifth Third Bank has allocated $7,980,000 of equity based upon the tax credits being issued by Ohio Housing. At the moment, we are $630,000 $1,736 short on the housing side, not on the treatment side. The treatment side is now fully, with this, and hopefully it will pass, will be fully funded. We are into the city of Cleveland under their ARPA program that they came out with roughly $25 million for affordable housing, and I think it was $10 million for conventional housing back on February 1st with an application deadline of February 28th. We submitted that. We have heard nothing formal or official, but in conversations, I feel good about it. And as most of you know, I've been developing affordable housing in Cleveland for 25 years, believe it or not. And I think based on that conversation, again, there is nothing locked down with it, but the city seems to be very supportive of doing this property. However, in the meantime, Councilman, the Finch Group has agreed to defer its developer fee, if necessary, to cover the shortfall. So we are ready to go presumably in July.
The recent events in world markets regarding the banking situation is particularly causing regional banks to be more cautious about lending and to pull in their horns on some things. My question is whether there is any potential impact of that situation on your project, or are your banking commitments fully nailed down and committed?
This morning, we met with the bankers on site. The first question I asked them was not as eloquently stated as yours was, Mr. Councilman, but it was the same question. And the answer I received, and we've looked at Fifth Third's financial statement, it is, as they described it this morning, they are a boring, mundane bank that has lots of deposit base. I don't have the statistics on it, that they are fully funded, that their ratios work, that they have matched their deposits along with a laddered set of investments, that they, as of, what time we leave, 12:15? As of 12:15 today, they are going forward with their commitment. We also have a takeout, a $2 million takeout, that is in writing from Cedar Rapids Bank, believe it or not. They're in the business of doing this a lot throughout the Midwest. So short of saying absolutely, I believe we're in very good shape with Fifth Third Bank. The day we close, I've been doing real estate development since 1970-something. You don't count on anything until the day you close and, the check's clear, so to speak. But I feel abundantly comfortable that they will be there for it. I can ask Stacy Woodford on behalf of NEF to speak if you'd like to hear from him. He is the representative of Fifth Third, but he's not Fifth Third.
So, speaking of closing, when would you expect the deal to close?
We believe it will close sometime during July, with meeting a groundbreaking sometime in July. I would say mid-July, just because July 4th weekend will throw everything off. We anticipate going in front of Ohio Housing on either May 10th or June 14th for the final approval. We believe we will get it. Again, we do not have it, but we believe we will get it. We believe it will be May 10th. If that happens, the legal documentation will be completed. We already have letters of intent and everything, but talking about the formal legal documentation will be completed in mid to the end of June. And then there's always that 1 week delay throwing us into July 4th, and that's why we pushed it back to mid-July.
Did you say that there's a representative of Fifth Third Bank present?
No, there's a representative of National Equity Fund who is providing the equity. The Fifth Third Bank they are the representative, I guess, of Fifth Third Bank. Let me introduce, this is Stacy Woodford of National Equity Fund.
I'm Stacy Woodford, National Equity Fund. We're the tax credit syndicator, the equity investor in this transaction. So we represent the Fifth Third equity investment, but also, the other kind of fifth third party in it is the construction lending side, in addition to, doing the bond underwriting.
Okay, thank you.
Councilman Sweeney.
Thank you, Madam Chairwoman. Just points of reflection. I've known the Finch Group for about 25 years, and I have the utmost confidence that the quality of this project is going to be extraordinary. And the need for this is absolute, but the real shout out goes to our chairwoman. She's been on this for about 5 years and trying to scrounge is the wrong word, but scrape together, put together.
What did I say? She held my hand and made sure I left money on the table for them.
Yeah, but she should be applauded, and the choice of the Finch Group is a great partnership, and I'm looking forward to the end of July and watching the faces of the residents and looking for the results as time goes on. So I'm just excited about it. Thank you, Madam
Thank you,
Chairwoman.
Councilman.
All right.
Madam Chairman, I'd like to make a motion.
Yes.
I move that we move this in an expedited manner to the balance of council so that we can get this project closer to completion of its financing capital stack.
Yes.
Second reading?
Yes. Second reading suspension.
I'll second that.
So it's been moved by Stevens and seconded by Sweeney. All in favor, please say aye.
Aye.
Thank you very much.
Madam Chair,
Yes, Councilman Miller.
may I please have my name added?
Yes, I think the whole committee would like their name added.
Thank
If we're
you.
not
Yes,
already
please.
on there.
Please, thank you.
We've worked hard on this.
Yes, thank you.
All right, Madam Clerk, if you could read the next item into the record.
Resolution 2023-0064, authorizing an agreement with Cuyahoga County Board of Developmental Disabilities in the amount not to exceed $1,400,000 for Medicaid home and community-based services for youth with developmental disabilities for the period January 1st, 2022 through December 31st, 2023.
Good afternoon, David Merriman, Department of Health and Human Services. I'm here with staff from the Division of Contract Administration and Performance, Marcos Cortez, who can answer procedural questions, as well as a staff member from the Division of Children and Family Services, Emily Freeman, who manages the relationship with the BODD. We're presenting a contract. This is an intergovernmental agreement that we have with the Board of Developmental Disabilities, where we share costs for youth that are either in custody and potentially going to transition to BODD services, or they are not yet in county custody, and we're trying to prevent that by having them better served with the Board of Developmental Disabilities. I'll ask Marcos to explain where we are in procedure, and Ebony to be available to answer technical questions about the services. One thing I want to acknowledge is this contract did begin in 2022. I just have to acknowledge the two staff that managed this both retired, and unfortunately there was a disruption in the agreement. When we found that to be the case, we had to go back and, in essence, resurrect the item. And this is again, it's an intergovernmental agreement where our dollars are used to draw additional Medicaid dollars in the community. And it's one of the better agreements where we work with the Board of Developmental Disability to braid funding to make sure youth are served. So let me ask Marcos to explain where we stand technically with the item, and then I'll ask Ebony to come forward and share a little bit of detail about the service.
Good afternoon, Marcos Cortez with Health and Human Services. So this contract before you is obviously late. We didn't hear about it until the end of November when the invoices that came in we couldn't pay. So at that time, we had to do our research because there had been a whole lot of transition with Department of Contracts Administration Performance, some transitions with Division of Children and Family Services. So we had to do our research to even get a grasp of this contract. Once we understood where we stood with it, we moved it ahead as quickly as we could, working with staff from Division of Children and Family Services, working with the Board of DD. We actually had an actual signed contract from DD from back in January, but we had to restart the process with, with our lawyers and again with the different divisions. So here we are presenting this to continue to provide the services and to pay the vendors. So again, any programmatic questions, Ebony Freeman can provide more detail about that.
Anyone have any questions? All right, seeing none, hearing none. I know it was extremely late, and I did try to get a department, Board of Developmental Disabilities, but they, did not have a staff available to come over. So it seems like Administrator Merriman covered pretty much the basis and conversation that I had with Board of Developmental Disabilities in terms of their end. So yes, we are really late on this, and I believe that what wasn't mentioned was they put up the fund, so it's basically a reimbursement. So we've got to do better. Any other questions? Okay,
I only
Councilwoman.
have the same statement you have. I think Merriman heard me, 45 minutes ago? So, and I know that you've been on top of this. We have got this, and this is the opportunity where council sometimes does this for posterity. We need you to tell us how we can help you do this better. Otherwise, we all look bad together.
So Councilwoman, I totally agree with you. First, I just acknowledge this is not on Marcos in any way. This is a situation that he inherited from his predecessor. But Marcos, you wanted to say something?
Yeah. So we are taking steps to address these concerns about late contracts or missing contracts. David mentioned earlier a contract tracker. So we have now updated our tracker and has everything that we know to be, something that we need to be on top of. We're also adding to that tracker like color coding that automatically will change colors based on the time frame that is out. So if it's 6 months out, it'll be a green color. If it's 90 days out, it'll be yellow. And the 30 days out would be red. We don't ever want to get to 30 days because that is not enough time to process a contract. So we're putting different things in place. Contract tracker is one of those, but also having dedicated teams to the different divisions where we can build relationships, have standing meetings with the different divisions. So we're meeting with them monthly to address procurement needs, to make sure the contracts are moving forward in a timely manner. So we're taking our steps to make sure that we don't have these issues going forward.
Okay, it's time to do a piece of legislation to get at least these folks moving in the right direction. Madam Chairman, I recommend that I ask my colleagues to agree to authorize this to move to the full board. Do you need this expedited? To the full council?
Second reading suspension, yes.
We do.
With second reading suspension.
Is there a second?
Second.
Okay, moved by Stevens, seconded by Turner. All in favor to move this to the full council under second reading suspension, please say aye.
Aye.
Right.
Madam Chair, before we move on to the next item, I did just want to take a second to introduce Ms. Freeman. Ms. Freeman is kind of a rising star within our system, working closely with the Board of Developmental Disabilities. I would say this is an emerging area where, despite a long relationship, we're actually intensifying how we do interaction, and Ms. Freeman has, I think, been instrumental in making sure that we stay connected with the BODDN cases. So I just wanted to give her a second just to introduce herself.
All right.
Good afternoon. I'm
Good
Ebony
afternoon.
Freeman. I'm sorry. And I am the program manager over our multi-system kids unit. So we work very closely with our other partner systems to make sure that our kiddos with high needs do not fall between the cracks. We identify any systematic barriers that we need and work collectively as a team to make sure that our kids and our families get the supports and services that they need.
Okay, so you're program manager for DCFS?
DCFS.
Okay.
I'm sorry.
What was your first name again?
Ebony.
Welcome aboard.
And how long have you worked there, Ebony?
I have been in this unit for 5 years.
Okay.
I've been with the agency for roughly 10 years.
Okay. Thank you.
And she's here on behalf of Jackie Fletcher, who had unfortunately a conflict, and she asked Ebony to represent her.
Fine. All right, thank you. Contract has been moved to full council under second reading suspension. Madam Clerk, can you read
Thank
the
you.
last item into the record, please?
Resolution 2023-0065.
All in favor, say aye if I didn't say that before, but okay.
Aye.
Sorry.
Resolution 2023-0065, authorizing Title 4D agreements with various providers in the total amount not to exceed $11,539,371.43. Excuse me, for child support services for the period January 1st, 2023 through December 31st, 2023.
Afternoon again, Marcos Cortez with Health and Human Services on behalf of the Office of Child Support Services. These again are our annual Title 4D contracts with these various entities for Title 4D eligible services related to the enforcement of child support orders. I can talk more specifically about the procurement part of it, but we have Director Tiffany Dobbins Brazelton and her business administrator, Richard Weiler here, who can answer any questions related to fiscal or program issues.
Let me just ask one question. I don't even think it's been a year. So if you could address that, because I know I don't get to see Director too much, so,
As far as I understand, these are annual, so these probably would have come about a year
okay.
ago.
Has it been a year? Okay.
Something, I didn't read this was the last one on my agenda. There's $22,000 for the county's treasurer's office. What's the process? Why do we include them in this?
The treasurer's office takes cash
Excuse me,
child
can you
support
state your name
payments.
for the record?
Oh, I'm sorry. My name is Richard Weiler, Business Service Manager for Child Support. The treasurer's office, along with juvenile court cashiers, take in cash payments for child support.
Oh, I didn't know that. I thought you had to go to child support.
There are two other locations. You can pay at the clerk of courts, or you can pay at the Virgil E. Brown building and underneath the JFS cashier's window.
Okay, well, that's why I paused this, because I'm like, that didn't compute. Thank you.
Any other questions? Director, you have anything, any updates, anything to share in regards to the contract or just anything in general in terms of the state making changes or anything?
Good afternoon, Tiffany Dobbins Brazelton, Director of the Office of Child Support Services. So nothing to add on the contracts. I'll just remind you about our Safe Access for Victims Economic Security Grant that we're working on and we're excited about to make sure that our clients have safe access to child support payments. And so we're working toward that with respect to domestic violence, and we already have a caseload for that. So that is one of the upcoming items that we're working heavily on. But as far as you asked the question about payments, we are also working on access, period, for everyone to child support, the ability, no matter if you're the payer or you're the recipient, to receive child support. So always just trying to brighten that spot in the community. We've been working on our rebranding within child support program for many years, and, just trying to educate individuals, communicate, and make it a safe place for everybody, no matter what end you're on.
And I like the safe access. So you guys applied for the safe access security grants?
The state office did, but
Okay.
we threw our hat in the ring, to be a participant county. So Cuyahoga, along with Franklin County, are the participant counties through the state.
Okay, and I also had a thought in terms of when we look at domestic violence, and just because of a phone call that I had, but not just with the child support, but also in terms of child care vouchers. So that's a future conversation I'd like to have with Administrator Merriman and Director Fletcher. So I know that's out of your bailiwick, but we know that women or families that are experiencing domestic violence is usually based on fear, finances, or,
Absolutely.
And
so I
getting
mentioned I mentioned the grant work, and so the other component of that is also recognizing when it's just not appropriate, unfortunately, for someone to be able to receive the funding that a family deserves. But we want to get our staff better educated, as well as the agency in general, to work with our partners locally to be able to recognize the signs of domestic violence and how we can best assist individuals when they come into our office.
Madam Chair, point of privilege. I want to thank you for the work you do. This is incredibly tough work. Families are already broken up by, some folks were never in the traditional sense married, and others, their families didn't work the way they had originally hoped for them to work. And so you're in a tough situation. Sometimes people misrepresent their income levels, usually 50 to 60% less than what they're really earning, and they're really depriving our children of a more solid way to live because they're not giving as much as they should to help a child grow up. It's unfortunate that we have to measure a person's income to get them to take care of their children. A lot of us were raised believing that parents automatically sacrificed for their children, but that's not true, and you see it too often in your day-to-day work. So thank you and your team for doing what other people aren't doing for their children.
Thank you, Councilwoman, and thanks for recognizing my team, because I definitely want to give credit to my team. You know, I'm here as a support system, but they do the hard work day in and day out, so I appreciate that.
Yes, Marcos?
Suspension.
I figured that. I'll be shocked if it's ever 3 readings, but, that's, okay. We're gonna move, I'm gonna make a motion to move this to the full council under second reading suspension.
Second.
Okay, moved by Conwell, seconded by Sweeney. All in favor, please say aye.
Aye. Okay.
No miscellaneous.